So for our interviews with experts today, I'm here with Dr. Yvon Fils-Aime from the Department of Mental Health here in the state of Oklahoma. And would you mind telling us a little bit more about yourself?
Okay, I am actually serving as the head of the Behavioral Health and Wellness Program for the Department of Mental Health and Substance Abuse Services.
Okay. How did you come to that position?
That was very interesting. First of all, I was working with OSU. I was leading the tobacco cessation program. I did that for approximately 5 years, and after that I realized that there was a need at the Department of Mental Health and Substance Abuse Services to enhance wellness program, and I decided to take that the opportunity to help them with that project. Yeah.
Okay. Can you tell us a bit about your background and training? What did you do before you came to Oklahoma and the job you have now?
Before I came to Oklahoma, I was working as a physician in Mexico. I worked for some years in Mexico as a physician. Later on, I went to Asia where I taught public health medicine.
Wow.
And later, when I come to the U.S., I did a master's in business administration, so I can have a combination between the medical part and the business administration. And this is pretty much what I'm using right now, the business administration part, and I dropped the clinical part for some time now.
Gotcha. Yeah. Could you tell us a little bit about the various programs you're involved in with the department right now?
We do have several programs that we are running, and one of them is to address the chronic disease that we have in the behavioral health population. We realize that if someone is diagnosed with severe mental illness and substance abuse, they are more likely to die 26 years younger than the general population. And that became a challenge for the state of Oklahoma. What we do right now, we develop programs to address chronic disease with strategic plan and with policies, and also working with several clinicians as well.
Okay. So trying to really address the physical and the mental health more hand in hand versus treating them separately as we have.
Exactly. In fact, right now we do have what we call the health home that will start very soon, where we will have primary care physician and behavioral health providers coming together under the same roof to provide physical health and behavioral health in order to decrease these 26 years premature death in the population that we are serving.
Okay. And can you say a little bit more about why the behavioral health population, the mental health and substance use population, is so important to do this kind of work?
You know, we see this group as a group that is that's a desperate group. When we compare them with the general population, we see them with a higher prevalence of diabetes, with a higher prevalence of heart disease, a higher prevalence of cancer. And they are suffering more from the 4 leading causes of death in the U.S. And probably that may be because of the lifestyle that they have, and also because of medication that they are taking that had some side effect with them. So that's present a challenge for our state. Yeah.
Okay. So it sounds like the healthcare system, at least in regards to the mental health system, is really transforming right now. There's big changes going on. What advice would you have maybe for our students in the class who may be wondering about a place for them in that as far as future careers or positions, combining that kind of integrated health approach?
You know, I see this as a great opportunity for them to not only have the knowledge in this clinical psychology field, but also to have some physical health knowledge as well. Now, the plan that the state of Oklahoma has, and that is pretty much similar to many other states, is to have one home where consumers or clients will come to have their physical health address and the behavioral health address as well. Now, let's imagine you're going to have the physician in one side and having the behavioral health in one side. And living in the same move and speaking two different languages.
Mm-hmm.
So that would be a challenge. So now one thing that we strongly encouraging to our student in Oklahoma is to get some fellowship integrated in the clinical psychology knowledge that they have, so they can have some physical health knowledge as
Sure.
well. So when they enter the behavioral health field, they will have not only the behavioral health knowledge, but at least they will have some basic pharmacology notion, some basic pathology, some basic clinical evolution of diabetes, of heart disease and blood pressure, cancer, and so
Right,
on.
right.
Yeah,
So they'd have some familiarity with health and healthcare. Maybe they're not experts, but they're familiar with it, so they speak the same language,
exactly.
like you said.
And the reason why this is really important, and we'll see the majority of the folks that will be graduating with a behavioral health major, they will be spending more time with the consumer or the patient than the physician.
Right.
Most of the time, the physician may spend, like, if it's a routine check, probably 5 to 15 minutes with the patient. However, the behavioral health expert will spend 1 hour or 1 hour and a half with the consumer. We say consumer, but it's
Right.
patient.
Right.
So if you need to change the health outcome of a patient, you are more likely to see the result based on the work that the behavioral health staff will be doing instead of the physician per
Sure.
se.
Sure.
Mhm.
Well, this has been very interesting, and I want to thank you for your time.
I enjoy talking to you. Thank you.